Welcome to Knowledge Park. In this video, we will learn about the male reproductive organs. We will see how each part works and why they are important for health. Let us start by looking at the main organs inside the pelvis. Here, you can see a simple outline of the pelvic area, with names of the parts shown clearly. First, let us look at the structure and main work of the male reproductive system. The male reproductive system has two main parts. One is the testes, which are the main organs. The other parts are called accessory organs, like the Seminal Vesicles, Prostate, and Vas Deferens. All these work together closely to help in reproduction. The testes, located in the scrotum, are the main male sex organs. They have two key functions. First, spermatogenesis, the production of sperm, and second, steroidogenesis, the production of male hormones like testosterone. Spermatogenesis happens inside tiny tubes in the testes called seminiferous tubules. A sperm cell has a head with the father's DNA, a midpiece for energy, and a tail to help it swim. Steroidogenesis occurs in special cells called Leydig cells. Testosterone is vital for developing male organs, causing puberty changes like a deeper voice, and maintaining sex drive in adults. The testes are in the scrotum to stay 2 to 3 degrees cooler than the body, which is essential for making sperm. Muscles in the scrotum help regulate this temperature. Now let us talk about the Vas Deferens, also called ductus deferens. This is an important tube in the male body. What is its job? The Vas Deferens is a strong tube that carries and stores sperm, which are the male cells needed for having children. This tube is thick and muscular. It starts from the epididymis, which is just above the testis. From there, it goes up from the scrotum, passes through a cord, enters the pelvic area, and finally joins with the duct from the seminal vesicle. During ejaculation, the thick wall of the Vas Deferens squeezes strongly, pushing the sperm forward. This tube also acts as a main place for sperm to stay and mature before they are released. Now let us talk about the seminal vesicles. What do they do? Their main job is to make a special fluid called seminal fluid. Even though the name sounds like they store sperm, actually, they do not store sperm at all. These are two small, twisted glands. You will find them just behind the bladder and in front of the rectum. Each one joins with the Vas Deferens on its side to make the ejaculatory duct. The fluid from seminal vesicles is very important. It makes up about 60 to 70% of the total semen. This fluid has fructose, which gives energy to the sperm so they can swim properly. It also has prostaglandins. These help by making the female body less likely to attack the sperm, and they also help the uterus contract, so sperm can move forward easily. After a man ejaculates, there are some special substances called fibrinogen-like substances in the semen. These help to make the semen thick for a short time, so it forms a kind of temporary jelly. This is normal and helps the sperm stay together at first. The seminal vesicles also make a fluid that is alkaline, or not acidic. This is important because it helps to balance the acid in the man's urine tube and also in the woman's body. By doing this, the sperm are protected and can survive better. D. Prostate gland. The main job of the prostate gland is to make a special fluid called prostatic fluid. This fluid mixes with sperm and helps to protect and carry it. The prostate is a small gland, about the size of a walnut. It sits just below the bladder and surrounds the tube through which urine passes, called the prostatic urethra. The prostate has different parts, called zones. The most important are the peripheral zone, where most prostate cancers start, and the transitional zone, where a common problem called benign prostatic hyperplasia, or BPH, happens. The prostate gland makes a special fluid that is 20 to 30% of all semen and is vital for sperm health. It contains a protein called PSA, which makes thick semen watery after 15 to 30 minutes, allowing sperm to swim freely. Other components include acid phosphatase, once a medical marker, zinc, which keeps sperm strong and safe from germs, and citric acid, whose role is unclear. The fluid is also alkaline, which helps neutralize acid in the vagina, improving sperm survival. Now, let's see how sperm and semen travel through the body. Sperm are made in the testes seminiferous tubules and then mature in the epididymis. During sexual excitement, sperm move into the Vas Deferens. At ejaculation, the Vas Deferens, prostate, and seminal vesicles contract rhythmically to push the sperm forward. First, prostate fluid cleans the urethra. Then, sperm from the Vas Deferens mix with fluid from the seminal vesicles in the ejaculatory duct. This mixture, now called semen, is pushed out through the urethra. After ejaculation, proteins from the seminal vesicles make the semen thick. PSA from the prostate then thins it again, allowing sperm to move easily. Common illnesses and which doctor to see. Let's look at common problems, their symptoms, and which doctor to visit. The testes can have several issues. Testicular torsion is an emergency where the sperm tube twists. Testicular cancer is common in young men. Infections cause swelling, while low testosterone can cause fatigue and low sex drive. For sudden pain, swelling, or a lump, see a urologist. For hormone problems, an endocrinologist may also help. The prostate can enlarge with age, called BPH, or get infected, which is prostatitis. Prostate cancer is also common. Symptoms include frequent or weak urination, pain, or fever. For any prostate issue, see a urologist. An oncologist is needed for cancer. Other issues include swollen seminal vesicles, causing blood in semen, or a missing Vas Deferens, which causes infertility. If you feel a painful lump in the scrotum, see a urologist. Lifestyle, nutrition, and exercise for good health. For healthy hormones and sperm, eat zinc-rich foods like pumpkin seeds, healthy fats from fish and nuts, and antioxidants from berries. These help produce testosterone and protect sperm. For a healthy prostate, eat lycopene-rich cooked tomatoes and broccoli. Green tea and soy may also offer protection. Avoid processed meats, excessive alcohol, and smoking, which can harm sperm and prostate health. Managing stress is also important for testosterone levels. Regular exercise is crucial. Cardio improves blood flow, while strength training boosts testosterone. Kegel exercises can help with erections. Finally, manage stress with yoga or deep breathing. Latest research and finding scientists are now finding that even the prostate and the fluid it makes have their own special bacteria, called a microbiome. If this balance of bacteria gets disturbed, it can cause long-lasting swelling of the prostate, or even increase the risk of prostate cancer. Because of this, doctors are now looking at using probiotics and antibiotics as new ways to treat these problems. For prostate cancer, there is a new scan called PSMA-PET. This scan helps doctors find even very small cancer spots that could not be seen before. It is very useful for checking if prostate cancer has come back or spread to other parts of the body. Now, instead of always taking tissue samples, doctors can use blood tests called liquid biopsies. These tests look for cancer cells, or cancer DNA in the blood. This helps doctors see how the treatment is working and if the cancer is changing without doing many painful procedures. Many researchers are studying how chemicals in our environment, like BPA, phthalates, and pesticides, are making sperm counts go down all over the world. These chemicals can even change genes in a way that affects children in the future. Scientists are trying to understand how this happens. Some scientists are also working on gene therapy to fix certain genetic problems that cause male infertility, like when the Vas Deferens is missing or sperm cannot move properly. They are using new tools like CRISPR to try and correct these issues, but this research is still at an early stage. Conclusion: the male reproductive organs are a very smart system, where hormones, body parts, and tiny cells all work together. To understand and treat any problems, it is important to know how each part works and how they all connect. For good health, we should use both medical knowledge and healthy habits, like eating right, doing exercise, and staying away from harmful things. This is the best way to keep the male reproductive and urinary system healthy for life. After 40 years of age, or if you have any worrying symptoms, it is always better to visit a urologist for regular checkups. Thank you for watching. Please like, share, and subscribe our channel. Stay healthy.